Hello, my friends. It is I, Revkes, and I've got a doozy for you. Okay, well, on December 19th, 2025, Secretary of Health and Human Services Robert F. Kennedy Jr. issued a declaration called Safety, Effectiveness, and Professional Standards of Care for Sex Rejecting Procedures on Children and Adolescents. Please take note that Mr. Kennedy is not a medical professional by any stretch, and that he has a history, even before this administration, of transphobia. This video contains all 12 pages of that declaration, including the footnotes cited throughout the document. Pause to read as needed. You can view the original PDF at www.hhs.gov. I have included the link in the description of this video. I would also recommend reading the article from S. Baum on Aaron in the Morning titled HHS Secretary Kennedy Attempts to Stop Trans Youth Care in Hospitals Nationwide Before New Federal Rules Take Effect. That was published on December 23rd on Substack and sent out through the newsletter mailing list that Erin Reed and her contributors curate. The opening to the declaration is one of the only wholly factual statements included. In recent years, medical professionals have documented a substantial increase in gender dysphoria diagnoses among young people in the United States, with similar trends throughout Europe. In response to this phenomenon, and following the publication of the Dutch Protocol and subsequent endorsements by the World Professional Association for Transgender Health, WPATH, and the Endocrine Society, yes, the number of children and adolescents receiving medical interventions for gender dysphoria increased substantially. But it goes downhill from there, especially with the creation of the new buzz phrase, sex rejecting procedures. The declaration continues the misinformation from the administration that the science doesn't back up the medicine, continuing to deny the research and medical evidence that gender affirming care does prevent many physical and mental health concerns for our transgender youth and reduces the risk of suicide and other self harming. On May 1st, 2025, HHS released a review of the evidence to identify best practices for treating pediatric gender dysphoria, and on November 19th, released the final peer-reviewed report, Treatment for Pediatric Gender Dysphoria, Review of Evidence and Best Practices. The whole process of the HHS report was a reiteration of the flawed CAS review and other similar reports from Europe that had questionable methodologies and politically biased conclusions. About the only positive thing I can say about the declaration is that they do cite that another term for these supposed sex rejecting procedures is gender affirming care, and that it, quote, encompasses several intervention types when provided to minors: puberty suppressing drugs that prevent the onset of puberty, cross sex hormones that induce secondary sex characteristics of the opposite sex, and surgical procedures, including breast removal and, less commonly, genital reconstruction. End quote. It then goes on to say that thousands of American minors have undergone these interventions without stating the statistics for which of these interventions are being utilized. The most commonly provided gender affirming care procedures are social transitioning, the taking of a name that matches the minor's gender identity, adopting clothing and hairstyles that reflect that gender identity, and the proper use of their preferred pronouns in family and public settings. Puberty blockers, which are medically backed by pediatric physicians across the United States and most of the Western world, are often prescribed to stunt the process of puberty to aid the minor in combating their gender dysphoria. Indeed, puberty blockers are more frequently prescribed to minors who are experiencing precocious puberty, that is, puberty occurring earlier than otherwise believed to be physically healthy, sometimes as early as age 8 when a cisgender girl starts her menses early or begins to develop breast tissue. Hormone therapy is frequently partnered with puberty blockers. None of these processes are taken lightly by the medical institutions, doctors, parents, and the youth who receive them. Intensive psychological therapy is included before doctors and care providers offer these interventions. Most of the time, parents are directly involved in the prescribing of puberty blockers, HRT, and other treatments. Only rarely do doctors recommend the surgical alteration of the patient's body, including top and bottom surgery. The declaration from HHS implies that the radical surgical alterations are prevalent. These irreversible procedures are the rarest of all gender-affirming care, whether for minors or adults. Indeed, many transgender adults do not have radical hysterectomies or orchiectomies, remaining with some or all of their physical sex attributes that they were born with or otherwise naturally developed through puberty. Those who do fully medically transition have an extremely low instance of regret or seek to reverse the visible aspects of their medical transition. Less than 1% of those who medically transition have expressed regret. What this declaration, the HHS report, CAS review, and other politically motivated responses to the reality of transgender youth and adults seeks to do is cause more psychological harm to these individuals and ignore the medical fact that gender is not a binary and never has been. You can do your own research on gender affirming care, the CAS review, and more on your own. Some of the best research you could do is to actually talk with a transgender individual. But don't be weird and ask personal questions that you wouldn't ask a cisgender person. Be a compassionate human being and learn that gender is just one aspect of who a person is. The declaration from RFK Jr. is open for public comment until February 17, 2026. There are 2 listings for it on the Federal Register. I have included links to both in the description of this video. Please comment on both. Even if it is just a copy and paste from one to the other, it is important that HHS and CMS know that thinking, feeling people are not in agreement with the draconian attempts by this administration to take humanity and independence away from our transgender friends and family. For more on this and other LGBTQIA2S SOGI issues, tune in to Lavender Hill on Sunday mornings at 11 a.m. U.S. Central on KZUM Lincoln. That's 89.3 FM in Lincoln, Nebraska, and online at kzum.org. The show also streams live on TikTok and Discord. Check out my link tree for those details.